Hello friends, welcome to Artificial Eye Co. Today we will talk about a case of artificial eye. I want you to observe this patient because this patient was using a customized eye but was not coming up for a follow-up checkup regularly and was not handling the eye properly. So where the patient is after 2 years. If you look at the lower lid, you'll see that there are some tissue growth that you can visualize inside. And if you just see without the eye, the lid is not completely closing. You can see thing or some open area. You see this also. The lid are not in normal shapes. So now look at this. You can see the fornix area and also the tissue that is inside. Now if I lift the upper lid, you will again see some reddish area which is pushing maybe if you wear a prosthetic eye, it will push the eye down. So overall this patient was wearing this artificial eye in 2015. When the patient was given this eye, she was very fine. But after 2 years, when we are seeing this patient with the same old eye, you'll see that the lower lid is drooping down and the upper lid is sagging. So you can see we are going to demonstrate that what we are looking forward. We want that the lid should not sag down. Yeah, it should look like this. Eye in a normal shape and condition is like the opening should be like a leaf. So we are just trying to understand that how can we restore that leafy structure. Now see again, the lower lid is down, upper lid is drooping down. Now see, this was the second eye which was made. You can see the tear film is being shown, how the tear is circulating and going to the canthus. And yeah, if you can see, the leafy like structure is restored. Now the upper lid is not drooping down, nor the lower lid is sagging down from the ear end or the temporal end. See, if we observe the old eye, the first eye is of 2015 and the second is of November 2017. Let's look at the back surface. See, when in 2015 the eye was totally flat from back, but now we have to make a hollow area in the eye after 2 years just because the patient was not under any proper care and management. The tissue has grown and the shape changed to this level. So you see, this is 2017 November's eye. If you see, this was the first day when it was fitted, but we will observe her after a few days. See, after a few days, what happens? The same eye, it fits so well with proper positioning, with proper leafy structure is restored. So what I believe is wearing an artificial eye is not important alone. You have to be under the guidance of your ocularist. Time to time you need to go for a follow-up checkup for polishing, because you have to understand with time the socket condition does change and you might need some modification, not the total replacement of the eye, but you might need some modification, and these modifications are really very important, because if you are not doing the proper modification of this eye, the space inside is getting distorted and you might land up with lid sagging or the other complications where you might not be able to fit another eye without going in for a surgery. So it's just not important to have just one prosthetic customized eye, but it is definitely more important to be under a supervision of some ocularist who has made the eye for you, so that you and he or she can work as a team for your restoring the health of the lid, so that you can wear the eye throughout your life. So if suppose the patient is of 7 or 8 years, we are definitely expecting the person to live for another 63 years. So for that 63 years, he or she needs to restore the lower lid, which is the main support for the eye. So you should always be in touch with your ocularist and never wear a ready-made stock eye, because that's going to damage the socket. Maybe today you have saved your money as well as time to buy that artificial eye, but in long run you will see that that eye creates so many complications that you land up in a position where you cannot wear any eye. Even if you go for surgery, you are not eligible to wear a prosthetic eye. So that becomes very painful because we see so many people who are coming. As a patient, you would never be knowing what could be the fate of wearing a ready-made eye. But as a clinician, we can tell you that many a times we have seen that the ready-made stock eye has created massacre and got lot of damages in the lower lid particularly, and you are unable to wear the eye. Or maybe even if you are trying to wear an eye, what happens is when you're talking to somebody, the eye pops down and falls and create a very false image for you, and you are into a very awkward position. So to avoid all these things, I would always recommend you to please visit your ocularist always periodically. Thank you so much for hearing.